Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
The mosapride. This mosapride does not cause Torsades D pointers. It does not cause Torsades D pointers, whereas cisapride causes Torsades D pointers, and because this cisapride causes Torsades D pointers, it is banned. Whereas mosapride does not cause Torsades D pointers, so it can be used. Then we have ketanserin. This ketanserin is a 5-HT2A antagonist. This ketanserin also blocks alpha receptor. Thus, it is an antihypertensive medication or vasospastic. It is used as antihypertensive or it is used in vasospastic disorders. Then we also have ritanserin. Ritanserin is also a 5-HT2A antagonist, but it does not have alpha blocking action.
thank you and thank you for watching.